I want to speak briefly about where we are 8 months into our fight against the COVID-19 pandemic. On March 12th, Maine reported its first positive presumptive case of COVID-19. March 12th, seems like yesterday. As of today, November 18th, 9,519 people in Maine have contracted COVID-19. 600 people have been hospitalized because of COVID-19, and 170 Maine people have died with COVID-19. Last month, it seems like just yesterday, we had an average of about 20 new daily cases, 7 people in the hospital, and a positivity rate, 7-day positivity rate about 0.58, sometimes even lower. Today, we've recorded 156 new cases, daily cases, 85 people in the hospital, up from 7, and a 7-day positivity rate now of 2.66%. You know, the winter surge that we were warned about, it's not just coming, it's here, and it's expanding, it's growing by the day. Back in March, we knew very little about the virus, but public health experts warned us that we had to flatten the curve, the rate of new infections, to prevent our hospitals from being overloaded and overwhelmed and unable to treat patients of any sort for any reason. Along with almost every other governor in the country, I made the difficult decisions to order Maine people to stay at home as much as possible, to close non-essential businesses, to recommend schools end in-person instruction. That was last spring. Those decisions were absolutely the last thing that I wanted to do as governor of the state of Maine. Would you want to tell people that they can't mourn the loss of a loved one at a funeral, can't celebrate a graduation from high school, can't gather with friends and family to mark some other important event? I didn't want to either, but it was necessary at the time, and it worked. Things are different now, both for better and for worse. We've developed a better understanding of the virus. We've developed new treatments to prevent its intense effects. Not widely used yet, but they're getting there. We've worked hard with our hospitals, healthcare systems, municipalities to expand our surge capacity and stockpile personal protective equipment, which we fondly come to know as PPE. We've put in place safeguards to reopen our schools and businesses, and with promising news almost daily on the COVID-19 vaccines, we're preparing for the distribution of vaccines in stages over time as they are approved, manufactured, and then distributed. At the same time, badly needed financial support is dwindling from the federal government. Unemployment benefits are expiring, and Congress and the president have been nothing short of negligent by not passing another aid package. All of that comes as we've entered the cold weather months, when people are more likely to gather indoors, get together with friends and family in settings that we once thought of as safe, but now, nationally, we know that's not the case. So after months of maintaining one of the lowest COVID-19 transmission rates in the country, Maine, like every other state in the nation, has seen a marked increase in cases, in hospitalizations, and positivity rates over the last month. For example, yesterday we recorded 246 new cases of COVID-19 in 24 hours. That is to say, every 6 minutes, another person was diagnosed with COVID-19. Every 6 minutes in the state of Maine, new diagnosis of COVID-19. Community transmission is occurring in every part of the state, every county, every region, increasing the risk of even the smallest gatherings of any sort, indoors especially. And like many people in our state, I'm deeply concerned about this alarming increase, especially as we head into the holiday season. We know what we must do to stop the spread. We know the 3 W's: wearing a face covering indoors and outdoors, washing our hands frequently, watching our distance, staying 6 feet apart. These are all proven ways to lower the risk of COVID-19. I was reading the paper this morning. West Virginia's coronavirus task force coordinator said, quote, "We believe we have a vaccine in our hands today and it's called masks and physical distancing. Each of us needs to take those steps now to protect ourselves and others so we can control this virus once again. Returning to normal sometime next year, hopefully, requires us to survive the holidays this year. And next week and the coming weeks will be a crucial test for all of us. Reconnecting with family and friends around a shared table to express gratitude for the gifts we've been giving, well, that's at the heart of Thanksgiving, of course. But it's also one of the riskiest things we can do right now for our health and the health and safety of loved ones, friends, families, our communities. Look, I've got 3 brothers, a sister, 5 daughters, 5 grandchildren, all of whom I would love to get together with over the holidays, and dear friends whom I look forward to seeing. But I don't want COVID-19 to be the uninvited guest at our table in our home. For the upcoming holiday, some of my family will be hunting, some will be hiking, some might even be skiing. Some will be taking part in small safety distance get-togethers, some outdoors, inviting others sometimes to join virtually. It won't be the same as getting together in person, but it will allow us each to see each other while making sure we're all safe, and that's what's most important right now. So as you make your own plans for Thanksgiving, please consider whether any in-person gathering is at all necessary, not just fun and comforting and traditional, but whether it's necessary in this time, this year. And if you think it is absolutely necessary, how can you make it safer? By wearing face coverings, washing hands frequently, watching your distance, being outside, ventilating in indoor spaces. Even outside of the holiday, though, many people need to ask themselves, do I have to take this trip? If the answer is honestly no, don't do it. Don't take the risk. It's easy to think, I'll just go to the store and pick something up, one more thing. And I'll just go to my favorite restaurant and hang out with friends for one evening. I mean, it's Saturday, right? But this virus doesn't take Saturdays off, and it doesn't take autumn and winter off, and it won't take Thanksgiving off. Think every time you want to do something, go somewhere that you're used to doing and going to. Do I really have to go out right now? Do I really have to go there? Do I really need to buy that one item at the grocery store or the drugstore or the hardware store right now? Or can I make a list for later on in the week or order things to be picked up curbside? Order something to be delivered perhaps. Just because a store is open for business, and they are, doesn't mean you have to go there in person. When you take a chance, like going to a store, wearing masks, keeping distance, even going out in public in general, when you take a chance, you're taking a chance with someone else's life, with someone else's well-being, with someone else's liberty, not just your own. Think about the home health care aide. Think about the emergency room nurse. Think about the ed tech, the teacher, the school bus driver, whose health and well-being are at stake every time any of us takes a chance. To the skeptics who may hear this message, not want to hear this message, I want you to know that refusing to follow public health guidance doesn't hurt me personally. You're not going to offend me, but it hurts the small business owner who's poured their life savings into their dream and whose dream is barely hanging on. It hurts the nurse who's at a breaking point after caring for seriously ill patients for hours, days, weeks, and months on end. It hurts the elementary school kid who doesn't have internet at home and is struggling to learn. It hurts the grandparents in nursing homes who are dying to hug their grandchild. Think of them when you decide whether or not to wear a mask, whether to attend a large gathering, whether to hold or invite people to a gathering. When your college kid home from school says, I want to have friends over, I want to see my high school classmates, think again. Tell them no. Tell them no. Listen to the science. These measures we're talking about repeatedly, these protect you and everyone else around you. Look, our state, our country has faced hard times before. We've had shared sacrifices. We continue to have shared sacrifices. They continue to be necessary. If you love this country, if you love this state, I ask you, Wear a mask. It's what true patriots do. It's what Maine people do. So bunker down, hunker in, buckle up, wash your hands, wear a mask, watch your distance. To all Maine people, again, if you want to keep our small businesses open, if you want to prevent our hospitals and healthcare staff from being overwhelmed, if you want to keep our kids in school, if you want to protect yourselves as well as people you may never even meet, wear your mask, wash your hands, watch your distance. Look, I know we're growing tired. This is not forever. There's hope at the end of the tunnel. There's a light there, but it has to be for now. These restrictions, these guidances have to be in place now in order for us to get a grip on this virus as we continue to make progress towards a vaccine. Remember, we can't have a healthy economy unless we have healthy people.